Question 1. A CNA observes a visitor yelling at and threatening a resident. What is the CNA's most appropriate action? A. Ask the visitor to leave immediately without further action. B. Report the incident to the charge nurse immediately. C. Document the incident in the resident's chart and monitor for future occurrences. D. Confront the visitor and demand they stop the behavior. Answer: B. Report the incident to the charge nurse immediately. This question tests your understanding of a CNA's responsibility regarding resident safety and abuse. Observing a visitor yelling at and threatening a resident is a sign of potential emotional or verbal abuse, and a CNA's primary duty is to protect the resident. The most appropriate and immediate action is to report such an observation to the charge nurse or supervisor, as they are responsible for intervening and ensuring the resident's safety. For instance, if a family member is being verbally abusive, the charge nurse can address the situation and involve necessary services to protect the resident. Always remember, when you suspect abuse or observe unsafe behavior, your first and most critical step is to report it to your supervisor. Question 2. A resident with dementia frequently tries to leave the facility. The nursing staff applies a restraint without a doctor's order to prevent the resident from wandering. This action could be considered A. Assault. B. Battery. C. False imprisonment. D. Negligence. Answer: C. False imprisonment. This question assesses your knowledge of residents' rights and legal boundaries, specifically regarding the unauthorized restriction of movement. False imprisonment occurs when a person is unlawfully confined or restrained against their will. Applying a restraint without a doctor's order and proper justification, even with good intentions, violates the resident's right to freedom and is considered false imprisonment. For example, if a CNA locks a resident in their room to prevent them from wandering without a physician's order, it would be false imprisonment. Always ensure that any restraint or restriction of a resident's movement is medically necessary, ordered by a physician, and properly documented to avoid violating their rights. Question 3. A CNA overhears two coworkers discussing a resident's private medical condition in the hallway where others can hear. This action is a violation of which of the following? A. Resident's Bill of Rights. B. Professional boundaries. C. HIPAA. D. Informed consent. Answer: C. HIPAA. This question focuses on patient confidentiality and the legal framework protecting it. HIPAA, which stands for the Health Insurance Portability and Accountability Act, is a federal law that sets standards for protecting sensitive patient health information from being disclosed without the patient's consent or knowledge. Discussing a resident's private medical condition in a public area, even among healthcare professionals, is a direct violation of HIPAA because it compromises the privacy of their protected health information, PHI. For example, talking about a resident's diagnosis in the elevator where visitors can hear is a HIPAA violation. Always ensure you only discuss patient information in private, designated areas and with those who have a need to know to protect their privacy. Question 4. A resident refuses to take their morning medication, stating, "I don't want it." What is the CNA's immediate response? A. Explain the benefits of the medication and try to persuade the resident. B. Crush the medication and mix it into food without the resident knowing. C. Document the refusal and report it to the nurse. D. Tell the resident they must take the medication as ordered. Answer: C. Document the refusal and report it to the nurse. This question tests your understanding of a resident's right to refuse treatment and the CNA's role. Competent adults have the right to make their own decisions about their care, including refusing medication, even if it is for their benefit. A CNA's role is not to force or trick a resident into taking medication, as this would violate their autonomy and potentially be considered battery. For instance, if a resident says no to a pill, you respect their decision, record it, and let the nurse know so they can address it properly. Always uphold the resident's right to choose by documenting their refusal and promptly informing the nurse, as they are responsible for following up and determining the next steps. Question 5. Which of the following actions is an example of elder neglect? A. A CNA assisting a resident with activities of daily living, ADLs. B. A facility failing to provide a resident with enough food and water. C. A family member visiting a resident frequently. D. A resident falling after trying to walk independently. Answer: B. A facility failing to provide a resident with enough food and water. This question addresses the definition of elder neglect, which is a form of elder abuse. Neglect occurs when a caregiver fails to provide necessary care, goods, or services to a vulnerable adult, resulting in harm or risk of harm. Failing to provide essential needs like adequate food and water directly constitutes neglect, as these are fundamental requirements for a resident's well-being. For example, if a resident consistently appears dehydrated or malnourished because they are not being offered fluids and meals regularly, that is neglect. Your role as a CNA includes observing and reporting any signs of neglect, ensuring residents receive the basic care they need to thrive. Question 6. A CNA is asked by a resident's family member to share information about another resident's condition. How should the CNA respond? A. Share the information, but only if the family member promises not to tell anyone else. B. Politely explain that resident information is confidential and cannot be shared. C. Tell the family member to ask the nurse for the information. D. Give general information without specific details. Answer: B. Politely explain that resident information is confidential and cannot be shared. This question tests your understanding of patient confidentiality and professional boundaries. All patient information is confidential and protected by law, even from other residents' families, unless there's a specific, legal reason to share it. A CNA must uphold this confidentiality strictly, regardless of who is asking. For instance, if a visitor asks about their friend in the next room, you must explain that you cannot share any information about other residents due to privacy rules. Always remember that protecting resident privacy is a core ethical and legal responsibility, so politely but firmly refuse to share any protected health information. Question 7. A CNA is assigned to care for a resident who frequently makes sexual comments and gestures. What is the most appropriate action for the CNA? A. Ignore the behavior and continue providing care. B. Tell the resident to stop the behavior immediately. C. Report the behavior to the charge nurse. D. Avoid providing care to that resident in the future. Answer: C. Report the behavior to the charge nurse. This question addresses how CNAs should handle inappropriate behavior from residents while maintaining professionalism and ensuring their own safety. While residents may have cognitive impairments, sexually inappropriate comments or gestures can constitute harassment and should not be tolerated. Your responsibility is to provide care safely and respectfully, and you should not have to endure harassment. For example, if a resident repeatedly tries to touch you inappropriately, you should immediately inform your nurse. The most appropriate action is to report the behavior to the charge nurse, who can then intervene, adjust the care plan, or involve other professionals to address the resident's behavior safely and ethically. Question 8. What is the primary purpose of an advance directive? A. To ensure the resident receives all possible medical treatments. B. To allow the resident to make decisions about their medical care in advance. C. To designate who will inherit the resident's property after their death. D. To prevent family members from making any decisions about the resident's care. Answer: B. To allow the resident to make decisions about their medical care in advance. This question explores the concept of advance directives, which are legal documents designed to protect a person's autonomy regarding their future medical care. The primary purpose of an advance directive, such as a living will or a durable power of attorney for healthcare, is to allow individuals to express their wishes about medical treatments they want or don't want if they become unable to communicate. For example, a resident might state in their advance directive that they do not wish to be resuscitated if their heart stops. This ensures their healthcare preferences are respected even when they cannot speak for themselves, empowering them to control their medical future. Question 9. A CNA observes a coworker roughly pulling a resident's arm while transferring them. This action could be classified as A. Battery, B. Assault, C. Neglect, D. False imprisonment. Answer: A. Battery. This question focuses on different forms of abuse and legal definitions. Battery is the intentional touching of another person without their consent in a harmful or offensive way. Roughly pulling a resident's arm during a transfer, even if not intended to cause severe injury, constitutes unconsented, harmful physical contact. For instance, if a CNA forces a resident into a chair by roughly pulling them, this is battery because it involves unwanted physical contact. It's crucial to understand that even actions seemingly minor, if they involve unconsented physical contact, can be legally defined as battery. Question 10. Which of the following is an ethical principle that means doing good for residents? A. Autonomy, B. Non-maleficence, C. Justice, D. Beneficence. Answer: D. Beneficence. This question tests your knowledge of core ethical principles in healthcare. Beneficence is the ethical principle that means acting in the best interest of others or doing good. In the context of CNA care, beneficence involves actions that promote the resident's well-being, health, and comfort. For example, spending extra time to comfort a distressed resident or helping them participate in an activity they enjoy demonstrates beneficence. Always strive to provide care that actively benefits your residents, enhancing their quality of life and promoting their overall health. Question 11. A CNA finds a resident crying and upset, stating that a staff member called them stupid and worthless. What should the CNA do first? A. Tell the resident not to worry and it will be okay. B. Reassure the resident and report the incident to the charge nurse. C. Confront the staff member directly. D. Ask other residents if they heard the comments. Answer: B. Reassure the resident and report the incident to the charge nurse. This question is about recognizing and responding to potential emotional abuse. When a resident reports being called names or belittled, it indicates emotional abuse, which is harmful to their well-being and dignity. Your immediate priorities are to provide comfort to the resident and ensure the incident is addressed. For example, if a resident tells you they were verbally abused by another staff member, you should console them and then immediately inform your supervisor. Always prioritize the resident's emotional safety and promptly report any suspected abuse to your supervisor to ensure it is investigated and stopped. Question 12. A CNA is documenting care in a resident's chart. What is a key legal implication of this documentation? A. It is primarily for family members to read. B. It provides a legal record of the care provided or not provided. C. It is only used for billing purposes. D. It helps decide which staff members get bonuses. Answer: B. It provides a legal record of the care provided or not provided. This question highlights the legal significance of accurate and timely documentation in healthcare. Documentation in a resident's chart serves as a critical legal record of all care provided, observations made, and changes in condition. This record can be used in legal proceedings to prove or disprove that proper care was given or that negligence occurred. For example, if a resident falls, The documentation of their ambulation assistance and call bell access provides a legal record of the care they received. Always remember that if it wasn't documented, it wasn't done, meaning thorough and accurate charting is essential for legal protection and accountability. Question 13. Which of the following situations most clearly represents a professional boundary violation? A. A CNA accepting a small, handmade card from a resident. B. A CNA spending extra time talking with a lonely resident. C. A CNA lending money to a resident or borrowing money from them. D. A CNA helping a resident choose clothes for the day. Answer: C. A CNA lending money to a resident or borrowing money from them. This question addresses professional boundaries, which are crucial in maintaining a therapeutic and ethical relationship with residents. Professional boundaries are limits that protect both the CNA and the resident by clearly defining appropriate behavior and interactions. Lending or borrowing money blurs the professional line, creates dependency, and can lead to exploitation, thus constituting a serious boundary violation. For instance, accepting money from a resident, even if offered as a gift, is a clear violation because it can exploit their vulnerability. Always maintain a professional distance, avoiding personal financial involvement or overly personal relationships to ensure the safety and trust in the caregiver-resident relationship. Question 14. What is the term for a legal document that designates a person to make medical decisions for a resident if they become unable to do so? A. Living will. B. Last will and testament. C. Durable power of attorney for healthcare. D. Do not resuscitate, DNR, order. Answer: C. Durable power of attorney for healthcare. This question distinguishes between different types of advance directives. A durable power of attorney for healthcare is a legal document that allows an individual to appoint a specific person, called a healthcare agent or proxy, to make medical decisions on their behalf if they become incapacitated and unable to communicate their own wishes. This differs from a living will, which outlines treatment preferences, or a DNR order, which is a specific type of medical order. For example, if a resident loses the ability to speak, their designated healthcare agent can communicate their treatment wishes to the medical team. Understanding this document is vital to ensure residents' wishes are respected even when they cannot voice them. Question 15. A CNA is unsure if a particular task is within their scope of practice. What should the CNA do? A. Perform the task anyway to avoid delaying care. B. Ask a more experienced CNA for guidance. C. Decline the task and wait for the nurse to assign something else. D. Consult the charge nurse or their facility's policy and procedures. Answer: D. Consult the charge nurse or their facility's policy and procedures. This question emphasizes the importance of understanding and adhering to your professional scope of practice. A CNA's scope of practice defines the tasks and procedures they are legally permitted to perform based on their training and state regulations. If uncertain, performing a task outside your scope of practice could lead to negligence or harm to the resident. For instance, if you are asked to administer a medication and you are unsure if CNAs are allowed to do that in your state, you must ask your nurse. The safest and most appropriate action is always to consult the charge nurse or refer to the facility's policies, as they can provide definitive guidance and ensure you work within your legal and ethical boundaries. Question 16. A resident constantly complains that their call light is not being answered promptly, and the CNA frequently hears this from others as well. This could indicate a violation of which resident right? A. Right to financial privacy. B. Right to participate in their care plan. C. Right to receive visitors. D. Right to respectful care and prompt response to needs. Answer: D. Right to respectful care and prompt response to needs. This question tests your understanding of fundamental resident rights related to care quality and responsiveness. Residents have the right to receive considerate and respectful care, which includes their needs being addressed promptly and their call lights answered in a timely manner. Delays in responding to call lights suggest a failure to meet basic care standards and infringe upon the resident's right to receive proper care. For example, if a resident needs assistance to use the restroom but their call light is ignored for a long time, their right to prompt assistance is being violated. Ensuring prompt response to call lights is a key aspect of providing respectful and quality care. Question 17. Which of the following is an example of libel? A. A CNA telling a coworker a false rumor about a resident. B. A CNA writing a false statement about a supervisor in a resident's chart. C. A CNA shouting false accusations about a family member in the hallway. D. A CNA documenting an accurate, factual observation about a resident. Answer: B. A CNA writing a false statement about a supervisor in a resident's chart. This question distinguishes between slander and libel, both forms of defamation. Defamation involves making false statements that harm another person's reputation. Libel specifically refers to defamation that is written or published, while slander is spoken. Writing a false statement about a supervisor in a legal document like a resident's chart, which is a permanent record, constitutes libel because it is a written falsehood. For instance, if a CNA falsely writes in a chart that a nurse is incompetent, that is libel. Always ensure your documentation is factual, objective, and accurate, as any false written statements can have serious legal consequences. Question 18. What should a CNA do if they witness another staff member stealing a resident's money? A. Confront the staff member and demand they return the money. B. Report the incident to the charge nurse or supervisor immediately. C. Inform the resident's family about the theft. D. Keep quiet to avoid conflict. Answer: B. Report the incident to the charge nurse or supervisor immediately. This question addresses the critical responsibility of reporting suspected financial abuse, a serious ethical and legal issue. Stealing a resident's money is a clear act of financial abuse and a crime. As a mandatory reporter, a CNA has a legal and ethical obligation to report any observed or suspected abuse to their immediate supervisor or the appropriate authorities. For example, if you see a coworker taking cash from a resident's nightstand, you must report it to your nurse right away. Your primary role is to protect the resident and ensure their safety and rights are upheld, which means reporting such serious misconduct immediately. Question 19. A resident expresses a desire to have a "Do Not Resuscitate" DNR order. What is the CNA's most appropriate response? A. Tell the resident you cannot discuss that and they must speak to their family. B. Inform the nurse of the resident's wishes. C. Try to convince the resident to change their mind. D. Immediately remove any resuscitation equipment from the room. Answer: B. Inform the nurse of the resident's wishes. This question tests your understanding of patient autonomy and the CNA's role in end-of-life care discussions. Residents have the right to make decisions about their medical treatment, including choices regarding life-sustaining measures like resuscitation. While a CNA cannot directly process a DNR order or provide detailed medical advice, they must advocate for the resident's wishes. For instance, if a resident tells you they do not want CPR, you should immediately inform the nurse, who can then initiate the proper channels to discuss and document the resident's wishes. Your most appropriate action is to respectfully listen to the resident and then promptly relay their wishes to the nurse, who can ensure proper medical and legal procedures are followed. Question 20. What is the primary purpose of a CNA's code of ethics? A. To outline the legal punishments for misconduct. B. To provide guidelines for professional conduct and ethical decision-making. C. To list all the specific tasks a CNA can perform. D. To determine salary ranges for CNAs. Answer B. To provide guidelines for professional conduct and ethical decision-making. This question focuses on the purpose of a professional code of ethics. A code of ethics serves as a set of moral principles and professional standards that guide the behavior and decision-making of individuals within a profession, ensuring they act responsibly and uphold the values of their role. For CNAs, it outlines expected behaviors like respecting dignity, maintaining confidentiality, and providing compassionate care. For example, the principle of treating all residents with respect regardless of their background is a core ethical guideline. The Code of Ethics helps CNAs navigate complex situations, ensuring they always act in the best interest of the residents and maintain high professional standards. Question 21. A CNA forgets to reposition a resident every 2 hours as ordered, leading to the development of a pressure injury. This could be an example of A. Battery, B. Assault, C. Negligence, D. False imprisonment. Answer C. Negligence. This question tests your understanding of negligence in a healthcare context. Negligence occurs when a healthcare professional fails to exercise the degree of care that a reasonably prudent person would have exercised under similar circumstances, resulting in harm to the patient. Forgetting to reposition a resident as ordered directly deviates from the expected standard of care and, if it causes harm like a pressure injury, constitutes negligence. For example, if you forget to give a resident their ordered hourly water intake and they become severely dehydrated, that could be negligence. Always follow the care plan diligently, as failing to provide ordered care that results in harm can have serious legal consequences. Question 22. A resident wants to review their own medical chart. What is the CNA's role in this request? A. Tell the resident they are not allowed to see their chart. B. Allow the resident to take the chart to their room to review it. C. Inform the nurse of the resident's request. D. Quickly summarize the chart contents for the resident. Answer C. Inform the nurse of the resident's request. This question addresses a resident's right to access their medical information. Residents have a legal right to review their own medical records under HIPAA and other patient rights laws. However, a CNA is not typically authorized to directly provide or interpret the medical chart. For instance, if a resident asks to see their chart, you should not give it to them yourself but instead tell your nurse so they can facilitate the request appropriately. The most appropriate action is to inform the nurse, who can then arrange for the resident to view their chart in a supervised setting and answer any questions they may have. Question 23. A CNA notices a small bruise on a resident's arm and the resident seems withdrawn and fearful. The resident whispers, "Don't tell anyone, but my son hit me." What is the CNA's immediate action? A. Promise the resident you won't tell anyone. B. Document the bruise and the resident's statement in the chart. C. Report the suspected abuse to the charge nurse immediately. D. Tell the resident that their son will be arrested. Answer C. Report the suspected abuse to the charge nurse immediately. This question is about responding to direct disclosures of elder abuse. When a resident states they have been hit, it is a direct disclosure of physical abuse, and CNAs are mandatory reporters. Your primary legal and ethical responsibility is to protect the resident and ensure the abuse stops. For example, if a resident tells you a family member hit them, you must report it to your supervisor immediately, even if the resident asks you not to. You must report immediately to your charge nurse or supervisor, as they are responsible for initiating an investigation and taking steps to ensure the resident's safety, overriding any promises of secrecy for the resident's protection. Question 24. What does the ethical principle of autonomy mean for residents in long-term care? A. Residents must always follow staff instructions without question. B. Residents have the right to make their own choices about their care. C. Residents should be isolated to prevent infection. D. Residents are responsible for managing their own finances. Answer: B. Residents have the right to make their own choices about their care. This question defines the core ethical principle of autonomy. Autonomy means self-governance or the right of individuals to make their own decisions about their lives and medical care, free from coercion. In healthcare, it emphasizes respecting a resident's choices, even if those choices differ from what the healthcare team believes is best, as long as the resident is competent. For example, a resident's right to choose what clothes to wear or what activities to participate in respects their autonomy. Always support a resident's ability to make choices about their daily life and care, provided they have the capacity to do so, to uphold their dignity and independence. Question 25. A resident has a Do Not Resuscitate (DNR) order in place. If the resident stops breathing, what is the CNA's responsibility? A. Immediately begin CPR. B. Call a code blue and wait for the emergency team. C. Provide comfort care and notify the nurse. D. Attempt to resuscitate with available equipment. Answer: C. Provide comfort care and notify the nurse. This question tests your understanding of a CNA's role when a resident has a DNR order. A Do Not Resuscitate order legally instructs healthcare providers not to perform cardiopulmonary resuscitation, CPR, or other life-saving measures if a resident's heart or breathing stops. Your responsibility is to respect this order. For instance, if a resident with a DNR order becomes unresponsive, you would not perform CPR, but rather focus on providing compassionate comfort care and immediately notifying the nurse, who will then follow the established protocols for end-of-life care, ensuring the resident's wishes are honored.